Thinking about getting a floating navel, but you're not quite sure what you should know? Well, you're in luck, because I'm going to cover just about everything you need to know before getting it done. Coming up next in Consultations by a Piercer, episode number 45. For those who are new to the channel, welcome to the Body Piercing and Tattooing channel. I hope you're enjoying the videos and finding them helpful, but you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. I'm going to talk about floating navels today. If you do not know what a floating navel is, it is a navel piercing that is done more inside the navel, usually with a disc. The jewelry has a disc on one side and then a gem setting on the other side. So it appears that there's only just that top gem floating there magically. It looks a lot like a single point piercing. The main reason why people get this done is because it works better in certain types of body types and navel shapes than a more traditional, more outside with the barbell with the two gems on it. For example, if you're a larger individual and you have a very deep navel, this is going to work better. If you have a hour shape to you that's very extreme and it kind of folds in that area, this is going to be a lot more comfortable. You're going to have less issues getting it done. The other thing is it allows you to pierce through that thin tissue, separate tissue, that kind of lobe tissue that's at the top of your navel, opposed to trying to kind of do a surface-to-surface piercing outside the navel so it's visible. If you are dead set on having that perfect, that navel look, you can try different types of jewelry shapes that'll give you this in the long run. But let's get into the heart of it. Average healing time, 6 months to a year, during which time I'm going to suggest you clean twice daily using a sterile saline solution. Personally, I like Neomed's Piercing Aftercare. Comes out in a fine mist. You just mist the area, leave it on for about 5 minutes, and then pat dry if need be. However, you may not be able to find that. So what you want to look for if you are trying to find saline other than that particular brand and type, the things you want to look for is the outside of the can should say sterile on it. It should be a metal can. It should be pressurized. When you turn it over on the backside, you should see mainly two ingredients: some type of purified water, and sodium chloride. Nothing else. There should be no preservatives or anything else. Now, with the sterile saline, there's kind of two different ways. Well, there's more than two different nozzles that work on this, but it's the most common two ways you're going to see is it comes out in a kind of a mist, or it comes out like a squirt gun. If you have the kind that comes out like a squirt gun, spraying that is just going to be kind of wasteful and might be uncomfortable. So what I would suggest doing is a cold compress. Take a sterile piece of gauze sponge, or if you have to, a clean paper towel, moisten it to the point where it's damp with the saline, and then apply it to the area for about 5 minutes. So the other thing I suggest doing is at the end of your shower, stick your belly out and let the water flow over the area for about 30 seconds. What we're doing with these two things is we're removing that discharge that hardens and crusts on the jewelry, the crusties. The reason we want it off there is when the jewelry shifts or moves or you move, it can agitate the piercing, which could lead to issues. It also tends to be kind of uncomfortable. Now let's move on to cross-contamination prevention. Common sense stuff. Wash your hands before you handle it. Try to handle it by the ends whenever possible. Really, you don't need to have any contact with this piercing except possibly checking the ends if it is screw-on, just to make sure they're on there. No oral contact or exchange of bodily fluids on near around the piercing until it heals. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing needs to be cleaned on a regular basis. Do not swim. I know you're going to see conflicting things on the internet about this one. The reality is, any body of water that's large enough for you to stick your whole body in and move around in is going to be filled with microorganisms. During the healing process, your piercing is an open wound. So anytime you submerge that open wound in a body of water, you are risking a foreign object working its way into the piercing and causing an infection. Keep pets away from it. Don't let them sleep in the bed with you, especially under the covers, and don't allow them access to your bed at all. They tend to have a lot of microorganisms and et cetera that live on in their fur, and then they transfer that to pretty much everything they come in contact with. Now, a big thing with navel piercings is their location and clothing. You want to wear clothing that does not have a waistband that's in direct contact with that piercing until it's healed, and possibly even after that. So the women's cut jeans, like the old Guess jeans from the 80s, I do not suggest wearing while you're healing the piercing and possibly afterwards. It's better to have something that has a waistline that's below the piercing, or something that's elastic and not stiff. Do not sleep on the piercing. Make sure you sleep it on your side or your back. Do not spin, rotate, or move the jewelry. There is absolutely no reason to do that. Do not play with it. Avoid contact with the piercing. Piercings like to be left alone. They're kind of like antisocial and all. Leave them alone. They'll heal better, and they're less likely to have issues. Now let's talk about the risks. With any oral or any navel piercing, the biggest risk is probably the jewelry separating from the post and the jewelry falling out. It's important that you do check the ends, especially if they're threaded jewelry, on a regular basis, just to be on the safe side. The other thing is closure. If you remove that jewelry and leave it out for more than a day, in most cases, even a well-healed navel will begin to close. It's a good idea, if you like it, to leave something in it. And the final risk is rejection. This is not so common as people think it is, but it's always a possibility if the piercing is done incorrectly, or your body just goes, hey, I don't like it. Now on to placement and angle. Basically, this piercing is done deep inside the navel and almost straight up. It's going to be a lot more shallower or closer to the ridge on the top than more of a traditional navel. It should appear that it's almost a 90-degree outward angle when the jewelry's in. If you take your index finger and you put it in your navel and you pinch down, you'll notice there's like a thin layer of tissue that separates from the fatty tissue. That's what we pierce in this case. And it really needs to follow that, and that's about it. As far as anatomy, knowing whether or not you have the correct anatomy or not the correct anatomy, if your piercer is worth their weight in salt, they are going to know by looking at the piercing and looking at your body type to decide which is going to work better. There is occasion where I'll look at someone's navel and I go, you work either way. We can do a floating or regular. That's not always the case, but it is possible. One thing you do want to have them do is have you sit and look at that area, because especially if you have kind of a crease there when you sit down, that can really dictate more towards the floating navel opposed to the regular, more traditional or normal navel. Jewelry. This is usually done with a curved barbell with a flat back disc that sits inside. The top can be a whole array of different types of ends. This is done either with threadless jewelry or threaded jewelry. Both work really well in this, and both give you a great variety of different ends to choose from. It should not be pierced initially with a curved or circular jewelry. However, since this piercing is more inside the navel, you may be able to get away with wearing a ring in it once the piercing is completely healed and seasoned. Now let's talk about pain in the piercing experience. Most people say on a scale of 1 to 10, this is about a 2. Not a very painful piercing at all. It does feel a little uncomfortable to have the clamps or forceps inside your navel digging around. We're just not used to people touching the inside of your navel. We don't run around and introduce ourselves that way. So that feels a little odd and can be a little bit uncomfortable. A breathing exercise always helps. What I generally suggest doing is I'll have the client, when I tell them, take a deep breath and hold it through their nose, and then exhale through their mouth. Smell the dinner, blow on it because it's hot. This piercing can be done freehand, but I advise, personally, forceps just make this much, much easier and a lot easier to hit your mark. Basically, first off, we will disinfect the area, then we'll mark it with you standing, then put you in a reclined position. Apply the forceps, inject the needle in and through, remove the forceps, line up the guide pin with the jewelry, push the jewelry in, and close the jewelry, and stop any bleeding that occurs. Usually these don't bleed a lot. It's pretty rare that they do, actually. Now, you might notice a little bit of throbbing and aching immediately afterwards. That usually fades in a few minutes, and of course, this can be tender to the touch for a couple weeks. Listen to that. That's advising you not to touch it, not to play with it, and not to bump it into things. Though I already talked about anatomy, I should probably bring this up because I didn't bring it up earlier. It needs to be an innie. Outies tend to not be a piercing that, or an anatomy that can be pierced either way. It really depends on the severity of the outie, but usually with this one, you definitely want a deep innie. And it's best if that navel is rather deep. Now let's talk about some things you should consider before getting it done. First off, you can't sleep on this. You want to sleep on your side or your back, and you want to prepare for that in advance. A couple tricks I've learned is putting a pillow between your knees or snuggling up to a body pillow will help keep you from turning over. High-waisted pants are completely no longer part of your wardrobe. Please go out and buy stuff in advance so you have it on hand so it doesn't turn into, well, I'll try it and see if it works, because it isn't. You may not be able to wear those high-waisted pants even after the piercing is healed. You need to take that into consideration of, is that particular fashion statement that important to you, or would you much rather have a navel piercing? You cannot swim. So if you have something going on in the summertime or whatever, and you like to swim, you might want to do this during a period of time where you're not going to be in the water. And lastly, are you going on vacation or traveling? Anytime you travel, there's a couple things you need to be concerned about. With a healing piercing, first off, you're dealing with cleaning it all the time and trying to keep everything clean. The reality is you're in an environment that you cannot control. Usually can't dictate how clean the bedding is or the room that you're staying in. And the other thing is that you're probably going to be introduced to pathogens that possibly you've never encountered before and you have not built up any immunity for. So it's a good idea not to do this right before you go on vacation or going on a trip. It's usually something you want to do when you're staying around the house and you can take care of it for 6 months to a year. Now, also, you're probably going to want to swim. You can't swim with a healing piercing. So, how many people out there have gotten a floating navel piercing, and what was that experience like? Go ahead and leave a comment. Till next time, here's hoping only piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see if your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video.